In recent years, we've made great strides in improving access to the full range of injecting equipment and paraphernalia that allows people to inject in a safer way. Professor Taylor's presentation highlighted the positive impact this has had as we see continued reductions in the reported episodes of sharing in the latest NESI study. However, sharing of equipment continues, and given some of the drivers that lie behind this, it's likely that this will continue to be the case for some people some of the time. What I'd like us to think about today is how can we maximise the benefits that comprehensive availability of injecting equipment affords. At long last, we're providing equipment that gives people the opportunity to use in safer ways. But can we do more to ensure that they have the knowledge and the skills to make the opportunity of safer use a reality? How confident are we that when someone is provided with injecting equipment, that they are fully informed on how to use it safely? Historically, our expectation is that provision of information on safer injecting practices occurs in needle exchange settings. But is this the only setting, or is it actually the best setting to have this discussion in? As we all know, needle exchanges are low threshold services. They don't demand a high degree of interaction and should not be too invasive for fear of the client disengaging. Perhaps there's also a belief that injectors are the experts and are knowledgeable and skilled in injecting practice. Maybe also there's a fear amongst workers that really getting in about the nitty-gritty of injecting is going too far. Maybe we're sort of reluctant to get into the sort of minute detail that's required to encourage people to inject safely. So I'm not sure, but maybe there's a sort of unspoken expectation on both sides that workers shouldn't go into too much detail and that service users shouldn't ask them to. So what I'd like us to think about today is what information or guidance or training could we provide in needle exchange settings? How would we get this information across? And who would be best placed to put this information across? And indeed, are there other settings where we can get this information across to service users? So maybe thinking first of all, what should be provided? Should we have some sort of standardised tool that can be used to ensure that all clients clearly understand the injecting process in detail? Can we go beyond the provision of leaflets? What about practical demonstrations? What about using DVDs? Whatever media that are meaningful and clients can interact with. Also, if we accept that some risky behaviours such as batch preparation of drugs or reuse of spoons and filters are unlikely to be eradicated, should we be discussing this with clients in an open way? If we dictate what is and what is not acceptable, does this lead to a breakdown in open discussion and prevent the opportunity for any positive change? What about incentives that could attract injectors to participate in interventions that improve their injecting practice? Thinking a bit more about the settings where these interventions could be provided, we know that drug users are in contact with a wide array of services, including treatment services, residential community rehab, recovery services, criminal justice, housing and homelessness. Are these settings where we could maybe engage with clients in a more, we've got more time to spend with clients and get in about the details of their injecting? Maybe also we should think about whether or not this information should only be provided to current active injectors. If we accept that drug use for many is a chronic relapsing condition, what about treatment providers, criminal justice services, social work, peer-led training, recovery-based services? All these settings may have an opportunity to engage more intensely than the low-threshold services such as needle exchange. Other opportunities, certainly around the provision of needles through pharmacies, where there's maybe limitations on times and pharmacy staff not being exactly specialists in the area. Perhaps you could have workers or peers that could go into pharmacies to provide training there. Similarly, in services who are non-specialists in addiction, so we could have drop-in centres, homeless units, where addiction workers or peers could go into these settings, engage with clients and trying to have more in-depth information about safer injecting practice. I think maybe underpinning all of this is not only the capacity of workers, but also the quality of training they had. So I think generally across a number of sectors, is there a need to improve our understanding of the processes and the forces involved in injecting drug use? The workers in a range of settings really have an understanding of this that allows them to engage in conversation with service users? Is there a need to enhance the quality of interactions we have with clients when discussing injecting drug use? As I said earlier on, perhaps there's a reluctance from workers to go into too much depth, and if that indeed is the case, then maybe the perception of service users themselves is, well, you know, this worker's not really going to be able to give me the detailed information that I really need, and consequently, especially new initiates to drug use when they start injecting, are maybe more likely to seek information and advice from peers in the community and so on. As we said, who should provide information and guidance and training, and what and how should that be provided? I think that's very important that we think about innovative ways. I certainly think that the idea that we can get information across just through provision of leaflets is probably misguided. Given the complexity of not only the injecting process as a sort of standalone process, but when we look at the complexity of that when it happens in social settings, and we've got a lot of social and interpersonal factors come into that, we really need to have a good understanding of that within the workforce, so that the workforce can then go on and have more detailed and productive conversations with service users.